Hello viewers, today let's have a quick review about beta blockers. When it comes to beta receptors, beta 1 receptor acts on heart and increases its heart rate and contractility. It also functions on kidney and increases release of renin from juxtaglomerular cells. In this way, it increases blood pressure. When it comes to beta 2 receptors, it acts by causing vasodilation and bronchodilation. It also acts on other cells like in the uterus, causing decrease in uterine tonicity and increase in insulin production and increase in glycogenolysis and other miscellaneous works, but its main function is increasing bronchodilation and vasodilation. And when it comes to beta 3 receptors, they act on the bladder and cause bladder relaxation. So beta blockers acts on these receptors and stops these actions. The main function of beta blockers is to decrease the blood pressure, and so they are indicated in people with hypertension. When it comes to classification, beta blockers are divided into beta 1 blockers, which are also called as cardioselective beta blockers, because beta 1 receptors mainly acts on heart to increase heart rate and contractility. And second, non-selective beta blockers. These acts on both beta 1 and beta 2 receptors. And third one is alpha 1 and combined alpha and beta blockers. The mnemonic you have to remember in beta 1 blockers is these blockers start with letters A to M. For example, atenolol, acebutolol, bisoprolol, betoxolol, esmolol, celiprolol, metoprolol. These drugs main action is on heart. They decrease the heart rate and contractility, and they also acts on B1 receptors of juxtaglomerular apparatus and decreases renin release, and thus they are mainly indicated in hypertension. As it decreases heart rate and contractility, they are also indicated to reduce angina pectoris, myocardial infarction, heart failure, hypertrophic cardiomyopathy, and other conditions which decreases stress from heart. Coming to non-selective beta blockers, as they act both on beta 1 and beta 2 receptors. The mnemonic for non-selective beta blockers is these blockers start with letters N to Z. For example, nadolol, propranolol, timolol, sotalol. Theoretically, these beta blockers resembles like as they are suppressing beta blockers, there can be unopposed action of alpha receptors and results in vasoconstriction. But in clinical practice, these non-selective beta blockers actually decreases the vasoconstriction. They cause vasodilation and helps in hypertension. Propranolol is also used to decrease sympathetic effects in hyperthyroidism, and they are indicated in portal hypertension. Timolol is used to treat glaucoma, and sotalol is used to treat arrhythmias, and that's it. Now coming to alpha and beta blockers, they act both on alpha receptors act on blood vessels and cause vasoconstriction, and beta receptors cause increase in heart rate and vasodilation. Alpha plus beta blockers are actually cardioprotective. Examples are carvedilol, levedilol. These are cardioprotective antihypertensive drugs. That's it.